Being pregnant is not the end of life. I personally was pregnant at the end of my senior 4, but I gave birth. After giving birth, I again went back to school.
Living in fear is the girl child. With less knowledge about sexual rights, making her a victim of sexual and gender-based violence. COVID-19 was a gateway to the perpetrators, leaving thousands of young girls helpless and victimized.
As much as we had registered a lot of successes, but the COVID-19 situation has actually increased cases, especially of gender-based violence victims and also sexual reproductive health violation and rights.
We were unable to reach all the population, all the youth that were always reaching out to. People were locked down, people were not receiving the services as a network were trying to render to them.
I work with Uganda Youth Network as a program officer. I also manage the Amplify Change project, and running in 6 districts of Buikwe, Kampala, Kasese, Rubirizi, and Nwaya.
We are in partnership with the Uganda Youth Network on a project called Healthy Living for a Healthy Young Generation. And this project is being implemented in the 2 sub-counties of Kasese district.
The project is running through 3 structures at the district level, and that is through peer education, district level advocacy networks, and also the change agents.
So with this project, as we implemented, we have been able to reach out the young people through models of using peer educators.
Peer educator nga narondibwa.
I am a peer educator, and my role is to advise adolescents on how they can take good care of themselves.
We started this work especially for training the youth in 2018. Basically what we have been teaching the youth, since in this lockdown, we have been teaching them skills of living with themselves and skills of living with others. We have been fostering gender issues, and we have been actually teaching them about how their rights cannot be violated.
Peer
educators taught us on how a girl child should protect herself, different family planning methods, personal hygiene, and a number of measures on how to protect oneself in a relationship.
As a project, we have tried to harmonize and address these issues, and as I speak now, for the last 2 years, we have been working with community structures, we have been engaging the police, we have been working with the office of the district, community officer, and sub-county CDOs.
Here in Kasese, we have a problem of adolescents. They normally produce at early age. We have good cases of early marriages in the community. That one, more especially, that is the biggest problem I normally meet when I go to the community.
The project has registered quite a number of successes. One, we have been able to reach so many young people with the information on gender-based violence prevention mechanisms, with the information on sexual reproductive health and rights, access and promotion.
Approximately 77.1%, the young people, they were not sensitized about their life and what they will do and what they want to be in the future.
Before Amplify Change came in, we as young ladies of Nyamwamba division, we were not able to identify our rights, mostly the sexual reproductive health rights.
There were very many challenges because they didn't know how to handle some things. They didn't know like menstruation is normal. They didn't know how to go about when it's menstruation, because these are the things they feared sharing with their teachers, they feared sharing with their parents, and they would shy away from them.
Young people babadde tebafuna health information cause abavubuka abamu betubadde tutuukirira, they are distant from health centers which can offer youth-friendly services like condoms, health talks.
You know, when you are not yet married, you fear to go to the facility to get these services, the prevention services. So now we have empowered the students, mostly those who are above P7, to get their services without fear.
Some youth have been actually having phobia to go to health unit to get condoms, but because of this friendship we are having with them, they can contact us and we give them condoms without going even to health centers.
The first phase of beneficiaries of the UYONET project gained a lot of knowledge that they put into practice and helped them withstand the temptations of not being in school due to COVID-19. It is also evident that many of those who did not participate in the trainings fell victim of circumstance, as many got pregnant and chances are high that they may not make it back to school.
Our husbands raped us. Actually, I will say it is marital rape, is it? Yeah, someone forces you. You're tired or not, he decides when or how to have sex.
For the case of gender-based violence, what we did as a network, we carried out a rapid assessment. We participated in the rapid assessment. And this we are trying to see, have young people reported cases through with gender-based violence at the police station? Have they received justice? And we found out that young people surely have faced violence.
We have generally bridged the gap between the young people and these social support systems, and we have made the young people aware that these are the offices that are supposed to support them, especially on issues of gender-based violence.
We are getting many cases of gender-based violence because buli gundi evaayo olikulaba nga erikuvaayo erikulwanirira omwana ow'obuwala, but they are not looking on boys' side. We are preparing a girl to marry an ignorant boy who is going to torture this girl day out, day in.
Because if you look at like the hospital, in a week, we can have about 4-5 cases in a week. That means in a month you have about 20 to 30 cases reported.
We have a lot of cases of gender-based violence. There are so many victims who are, majority of whom are young people. So we brought on board Justice Care to address the issue of gender-based violence.
Actually, some youth, they were not in a position to access justice, more especially when their rights are violated. But after telling them, teaching them how they can access justice when their rights are violated, more especially rape, defilement, actually they have been in a position now to report. They know whom they can report to in case they become a circumstance of that situation.
So Justice Care is supporting us to provide legal aid to the victims of gender-based violence.
ICAD has been of much help to us. It has stood by the girl child and the youth in a number of ways. We had none to run to with the problems affecting youth, but now we do thanks to ICAD.
We have had serious issues that have really resulted out of the COVID-19 pandemic. Like currently, before we used to work with out of school, 13 to 24 out of school. But because of the problem, the number is now high. Most of the young people are now out of school. The groups we have so far, they are very small in number. We should be having members up to 30 in each group. But today, we have been having 10, 12, and you can't blame anyone that the peers blaming them having very few people. I only think it is because of COVID-19.
You know, the peer educators' activities of having the weekly sessions, it has also been affected. The numbers have tremendously reduced since we don't have enough space to accommodate. And also it is against the presidential directives of having those big gatherings.
COVID-19 Before COVID-19, attendance of the youth was high and convenient compared to the current situation where only a few youth can convene.
There was a problem of transport because there was no vehicle that could be moving, a motorcycle. We could use only a bicycle, but unfortunately we never had bicycles.
UYONET has provided the bicycles to the peer educators in the sub-counties so that they are able to reach the communities with the messages around sexual gender-based violence.
We have been using the bicycles to reach those beneficiaries. More especially, these youth, they are not staying in the same place. We normally visit them. As I earlier on said, that we normally do a spot visit.
COVID-19 not only affected the economy nationwide, but also at a personal level.
For the young girls who had started small businesses and could afford paying maybe to buy pads and maybe get some milk for their young children, they are not able to get so. So there is also another risk that as a result of the COVID-19, we may see more pregnancies coming out. We may see other drug addicts coming out. We may see other sorts of challenges coming out.
As a peer educator, the pandemic hindered my day-to-day activities of encouraging my fellows to take their medicine. It has been hard and difficult to consult and also watch out for them during this period. Many cannot talk to others about their problems except for me, their peer educator. The pandemic affected me significantly. I was so excited to finally get promoted into Senior 4. But when it hit, we were sent back home, and I have lost the whole year. Besides gender-based violence and sexual reproductive health, the project has provided hands-on skills to the young girls. We have learned how to make handcrafts. We normally get together to decide on what materials to make. For example, we have learned how to make baskets.
Since I learned how to make these pads, I'm able to help my sisters, my friends, because even them, they never knew how to make.
Previously, we were buying 2 packets of sanitary towels at 6,000, but now we can purchase a material at 9,000 and make pads that last a year. We thank the project for the impact on our community. It has managed to reduce misconduct and early marriages in Buyikwe district.
Actually, this project has helped because most youth have been affected by teenage pregnancies.
We thank really so much Uganda Youth Network that has been supporting us to see that we scale down all these issues that are affecting the young people in Kasese district. We have been working with the media, trying to popularize the issues around and condemning the bad acts that really hinder young people from achieving their set goals.
We kindly request the funders to extend the project time. This will enable us to reach more young people that we were not able to reach due to the shortcomings of the pandemic.
We appreciate Uganda Youth Network, who has been leading us in the Amplify Change program. They have trained our members to advocate better. Our partners have been empowered enough.
I will once again thank Amplify Change for the project, and I will appeal that we need more time to actually scale up where the project is not, because we are working in only 2 in each district. So if we could scale up to more sub-counties in each district, I think it will create a much bigger desired impact.